Welcome to Mind Your Mental Health channel, a channel for mental health awareness and psychological well-being. This is the 21st episode. In this episode, we are going to talk about generalized anxiety disorder. In the previous episode, we did talk about an overview of anxiety and anxiety disorders. So, in generalized anxiety disorders, the main symptom would be worry, stress, and the worry is mostly about everyday situation. And the important thing about the worry is it is an excessive worry which is out of proportion to the given situation. And the worry is about general things, the day-to-day things, what is happening. It is not about specific event. We all know that it is human nature to worry about certain things in our day-to-day activity. But people who suffer from generalized anxiety disorders, which is one of the anxiety disorders, will have constant worry about everyday situations. Like for example, if one of the family member would come home, say around 4 o'clock or so every day. If they are not coming at 4 o'clock, they're coming 5 minutes late or 10 minutes late, which would have happened. However, people with generalized anxiety disorder will have a lot of worry about themselves, and they will always think about the extremes or catastrophize that late coming, and they will think about a negative outcome which could be extreme, and they will be constantly worrying till they come home. And after that event is over, it is natural for them to worry about something else that is happening in their life, in the day-to-day situation. So, the generalized anxiety disorder can occur in about 5 to 7% of general population in any point in their lifetime. And the research has shown that women suffer more with generalized anxiety disorders. So, what are the symptoms of the generalized anxiety disorders? As I mentioned, excessive worry, which is out of proportion to the situation, always feeling tensed and stressed, and they may complain of awareness of their heartbeat, what we call it as palpitation, tremors, tremulousness, uneasy feeling in their stomach, and sometimes they may feel dizzy, and sometimes they will say that they feel exhausted, they feel tired. Apprehension is one of the main symptoms of generalized anxiety disorder, and anxiety also, we said. They are actually worrying and fearful of the unknown, the uncertainty. See, they wouldn't know what is happening on the other side, but still they have the worry about the outcome of it or their uncertainty. So they'll always want things to be very certain like what time people are coming home, who is coming home, what is going to happen. They want a perfect plan, but sometimes or most of the times in life there are uncertain things that could happen which they may not be able to cope, and they will become extremely anxious about it and worry about it. So their thinking is that worry will be so extreme that it will really will not help them to be calm, to be able to sit and relax. So they'll be constantly walking about, restless, and seeking sometimes for reassurance that nothing is going to go wrong, nothing untoward is going to happen, nothing negative is going to happen. And generalized anxiety disorder is a chronic disorder. It is a long-term illness, mental illness, which affects, as I said, mainly women. Sometimes they could have the symptoms starting even in their early adulthood or teenage, and they may not know sometimes they are suffering from generalized anxiety disorders, so they may not seek help at all. And therefore, the diagnosis will take a bit longer for them, and they will also seek help later in their life. And when they have generalized anxiety disorders, at some point in their course of the illness, it will interfere with their day-to-day activities because of their continuous worrying, being stressed and anxious throughout the day, which will interfere with their day-to-day activity. Therefore, they will avoid certain things. They may avoid going out. They may avoid going to work sometimes when it is too stressed at the workplace. They may avoid going to certain important meetings, functions, or exams or interviews. So therefore, when it becomes extreme, it may disable them. As we learned in the previous episode, the anxiety has to be optimum for someone to perform well. So in generalized anxiety, sometimes the anxiety is so excessive and the worrying is so excessive that sometimes it disables them to do their day-to-day activities. So at times they will need to be reassured repeatedly by the family members, friends, or they will need someone to accompany them because they are having extreme anxiety to go out on their own. And people imagine and people worry as though it is going to happen when there is no evidence at all. The physical and the psychological symptoms are actually making so many changes in their mind and in their body, which after sometime, after few months or few weeks, makes them very overwhelmed and exhausted because they are chronically worrying about something which is actually disproportionate to their worry. So it has an impact on their mental health and psychological health. And there are times it goes out of their control. The worry goes out of their control. The anxiety goes out of their control. Therefore, they need some help from a family doctor or from a psychiatrist or from a psychologist. It is important for the family members also to understand the nature of their anxiety, because people with anxiety disorders cannot rationalize their own worry and thinking and anxiety. They feel that it has gone out of their control. If the family members or friends try to rationalize their anxiety or fear, it will be really irritating for them. So one of the important symptoms could be irritability. So if one of their friends or family members trying to tell them that there is no point in them worrying or being anxious because they don't know what is the outcome, none of them know the outcome, they have to wait for it, and worrying is not going to help them, they will not be able to actually agree, or they will not feel supported by that sort of a explanation to them. To some extent, their judgment can be impaired because of their anxiety, because they'll be only thinking at times about the negative outcome. So when the others explain that it is not appropriate for them to be anxious, they feel that they are not being supported, and the family members and friends are not being helpful when they are anxious. And that's when they become angry and irritable and would not be able to control their anxiety at that time, and they may even break down and become tearful. So many a times when someone has had symptoms of anxiety disorder for a few months and years together, they will develop secondary depression. So they may have symptoms of depression too. One may think, what is the cause of generalized anxiety disorder? Many of the mental disorders don't have a single cause for the disorders. To give an example, for certain physical illness, we know there is a bacteria which is the reason for that illness. There is a virus which is the reason for the illness. There is a fungus which is the reason for the illness. For generalized anxiety disorders, or many of the anxiety disorders, there is no one factor that is the reason, or what we call it as etiology for the disorder. There are some biopsychosocial factors that could be the reason for some of the mental disorder. In a similar way, for generalized anxiety disorders, it could be genetically transmitted. Their parents, their grandparents, or aunts and uncles might have had the illness. Sometimes people who have experienced some traumatic events, who have gone through a lot of stress in their life, will be vulnerable for generalized anxiety disorders. Some of the endocrinological illness can have symptoms similar to generalized anxiety disorders. Some of the life situations could be the reason for their generalized anxiety disorders. They are having some chronic stress in their life. So it is important for someone to report the difficulties, mental health difficulties, what they are going through, to the family members or friends, or to their family doctors to seek help. Because generalized anxiety disorders, when it becomes chronic, it is difficult to treat, and it becomes more disabling to that particular person, and the quality of their life comes down. So it is important for someone who have symptoms of generalized anxiety disorders to have an awareness to seek the appropriate help for their illness. With the appropriate help, which could be psychological, which could be pharmacological, can actually give them a better quality of life. We all know anxiety, constant worry and stress is very distressing to oneself. Anxiety is a very unpleasant emotion for anyone to go through. So everybody wants to be less anxious. Although anxiety is a common feeling, I said, people with anxiety disorders are having difficulty to touch their base. We have to understand that in normal anxiety, it is natural for the anxiety to just go up, and then after some time it comes down naturally. Say for example, if someone is in an anxiety provoking situation, and if they avoid the situation, which is very common in generalized anxiety disorder, and run away from it, their experiences, because they run away, their anxiety has come down. But actually research has shown that if you stay in the situation and try to tolerate the distress or anxiety or endure that distressing situation, the anxiety comes down on its own, and you will learn that in the same situation when you became anxious, after some time you are coming back to your base and you are able to experience that you are less anxious and you are able to cope with the same situation which provoked anxiety. And sometimes you have seen some of the family members or friends will actually tell you that, come with me, I will tell you that there is nothing going to happen. There is nothing untoward will happen as you predict or as you imagine. And once you go there, you will agree, yes, that didn't happen. So people with anxiety disorder, because of this avoidance, they will not give a chance to themselves to come back to that base level or come back to a level where they are less anxious and able to cope with it. This is one of the psychological, behavioral techniques or therapy. Sometimes in cognitive behavior therapy, the patients will learn how to cope with their anxiety. So how do we manage the generalized anxiety disorder? There are some self-help therapies. There are certain breathing techniques like you can learn to help your anxiety, to calm yourself. There are certain psychological therapies like cognitive behavior therapy, which will help you to understand your anxiety, understand your worry, understand your thoughts while you're worrying, and understand your feeling because of your thought or imagination, and understand your behavior because of your thought, your feelings. Your behavior could be affected. So once you learn what your generalized anxiety is making changes in your mind and body, through cognitive behavior therapy, you will be able to actually break that cycle which actually interferes with your day-to-day activity and makes you more worried and more anxious and more tensed. So for generalized anxiety disorders, there are some medications which are antidepressants that are licensed or that are effective for anxiety disorders too. There are some short-term anxiolytics which can be given with the medical supervision and the advice of the specialist. It is not appropriate to take the over-the-counter medication, self-medicate yourself. Sometimes it can lead on to some other problems. So when people are anxious, when the anxiety, especially like in generalized anxiety disorder, when it goes out of their control, they think they have to seek control from outside. That could be over-the-counter medication. That could be, for some people, they think drinking coffee, tea, or some energy drinks can help them, can help their anxiety, or even smoking or taking alcohol can. But people who have actually followed all this will know it is only temporary, and it is more of psychological feeling that they think that the anxiety is coming down. It is important for someone to know that coffee, tea, and the energy drinks like Coke and other energy drinks, they also contain more of caffeine. They may increase your anxiety instead of decreasing your anxiety. Excessive smoking and alcohol can lead on to other mental health problems and sometimes worsen the anxiety too. So it is important for you to be aware what can worsen your anxiety, what can actually help your anxiety. And the family members, it is important for you to know how to support them and how to actually understand their anxiety, because it is true for them. The problems or the symptoms they go through is out of their control at times, and it is important for you to understand and support them in the recovery of the illness by encouraging them to do their behavioral therapies, to take them to doctors and the therapists to help them to cope with their anxiety. So it is important for you to remember that there are some coping strategies which are maladaptive, which can worsen your anxiety, which can lead on to some other mental health problems, or for some people it can also lead them to alcoholism or misusing some substances, because they think when the anxiety is overwhelming, they become panicky, and sometimes the illicit substances, alcohol, or over-the-counter medications help them. But most of the time, it lands them into another problem. So it is important for you to understand your anxiety, accept that you have an anxiety disorder, and learn that there are appropriate interventions for the anxiety disorders. And if you are able to get the correct treatment for the anxiety disorders, certainly your quality of life will improve and one will be able to cope with the anxiety. In the next episode, we will be talking about panic disorder.